Hi, I'm Peter James Webster, um, formerly Randy Webster, and known as a few other names too, but mainly those are the two names I've been known as. I am a transgender person, formerly a woman, externally. Internally, I've always been a man. Um, I'm very happy to say that I've just completed my what's called top surgery. It's a reassignment surgery, as I'm calling it, to correct what I believe was a birth defect. So anyway, I'm going to show you my surgical thing so far. The scars are just recent. A lot of the stitching is gone. The nipple grafts are still forming, and I'm putting medicine on them. I'll kind of show you how to do that. Okay, so I'll be with you in a moment. Okay, hi, I'm back again. Well, this is me. See, I got surgery on February the 4th. It's now February the 23rd. This is how the nipple grafts are looking right now. And now the scars underneath are looking. They went pretty far around on me. I'm thanking them for doing that because there really was a lot of extra flesh. Now, mind you, there still is a lot of extra flesh. I'll be doing some toning with weights and stuff, and I'll be doing some work on the scars, and I have like extra flesh all over the place. I've lost an incredible amount of weight. How I did that was, believe it or not, a combination of things. Of course, exercise, a lot of walking. I live in San Francisco, and I'm getting my medical things together. And right outside my house is a beautiful park that's up a flight of steps. And so I used it to help. First, I was really too heavy to even do that, so I started out just walking up and down a couple of the main streets right around where I live, because I live up on top of, near the top of, in the Russian Hill area. And so, as the name implies, there's a lot of hill up there. So yeah, between walking and the other thing I did was I did a very strict diet that I still kind of actually follow. It was, I did protein shakes, believe it or not, Slim Fast is what I used, twice a day, and a sensible meal. Now that I'm on maintenance, I can allow myself, a few other things, and I'm not always doing Slim Fast. Like while I'm healing, I'm doing like some Slim Fast, but I'm also doing a couple other things, like some shakes have like extra amino acids and stuff. Now they don't have as much fiber as, say, the Slim Fast or some of the other similar products. And fiber is kind of important to me. Right after surgery, oh man, get yourself regular as soon as you can. Anyway, so as far as taking care of my scars go, I'm giving it just, there's a couple of other spaces here that are still healing a little bit. So I'm going to give them a couple more days to heal. And that's all done. Then I'm going to be starting to treat them with, treat the scars with some creams and other treatments. And I'll fill you in on that. I think one is a Scar Guard I was looking at, and there's a few other products. If anybody has any suggestions or anything, I'd be happy to hear your suggestions. If anybody who really, I should give a little warning, if anybody who really doesn't like seeing this stuff, this is education. This is life. This is what a person goes through who wants to have reassignment surgery. To me, it's corrective. It's correcting a birth defect. I was not wired to be a woman. I was I tried, but it just didn't. It just didn't apply. It just, Anyway, so what I'm applying here on my skin, speaking of applying, is on these here graft areas. Grafting is Neosporin. Okay, and the doctors also will supply you with other things like antibiotic stuff. Use it properly. The idea is to keep the area moist while it's healing, because it's adhering, it's building new skin. And the best way to do that is by keeping it moist and clean. Old Fred here, a little bit extra attention, because he's a little more delicate right now. He's always been that way. Old Fred Mertz here. That's Fred. Well, I don't know if everybody names theirs, but I had to deal with it somehow, and when I was also a person with not only gender identity disorder, but a dissociative identity disorder as well. If anybody's read my blog, they'll know what I'm talking about. If not, you can find me at peterjameswebster.wordpress.com, and my blog is right there. It's called Transformed, because that's how this stuff happened. Not only the fact that I have striven and received these corrective surgeries, and hope to get as close to all of everything as I can someday. Please correct the genitalia areas, and I'll be very happy. But in the meantime, I'll make do. I do fine. Actually, it's a very interesting scenario. Webster's doing pretty good. Yeah. All right. Now, I'm just going to go ahead and really pack it on here, because I'm going out for the evening, and the object is not to let this stuff dry out. The skin grabbing stuff is real important to be kept moist. I am hopelessly right-handed, by the way. There you go. I want to put some right on everything. I know. Fred's gonna be alright. Everybody say some nice little prayers for Fred. But also, I added, my brother Jim needs some prayers too, and his family. I'm going to be going out. So I have to really make sure I'm going to be packaged well. People like to hug. We'll be going to visit my friends at the saloon. Here, nice little non-stick thing. One side has a seam sometimes, so you gotta really watch for it. There's the flat side. Now here's what I'm doing. I'm putting this right over all of that, and really pressing it down. I want Fred to be all tucked in nice and good. And no one left it, obviously. Yeah, I will make sure to cover all the skin grafts, okay? might want to set a little bit more on there. I'd rather have enough than not enough. Right, there you go. Okay, now then, here's what you do. Get it all nice and on there. Feel around. And it's going to be a little warm. You gotta remember, it's not hot. I'm not feeling achy. I don't have any low-grade fever. I don't smell. I'm not swollen. I've been monitoring all those sorts of things. Now, put a little fold over on the side here. The tape, it makes it easier. See? Now, of course, it also, you have to tape it down securely. As I said, people want to hug. Alright. There we go. Neat thing is, I will say, I've been enjoying not having to wear binders. Before that, when I was younger, it was as a woman, it was bras. When I lived or tried to live as a man, it was usually wound in, first it was ace bandages, of course. Everybody did that. When I came back this time, I was lucky to run into sports bras. And so, try not to get any of your ointments on where you're trying to take, because it just won't stay. Yeah, there will be, some extra flesh issues, of course. I'd be lying if I said otherwise. Nothing I wasn't prepared for. But it's certainly nowhere near as bad as I've seen. I've seen some real situations where, I want to thank Dr. Kim for doing an excellent job. Very excellent. Seriously. Anyway, I'm adding a little bit of extra layering to this because I'm going out. Okay, but anyway, so that's all that. Okay? So, I do have some chest hair. I also have some extra flesh, of course. I have some chest hair coming in. This here beard, let's see, I've been on testosterone 2 years now almost. I knew it was going to take off like wildfire on me. I knew it. And happy am I. I want to thank doctors and therapists, including Dr. Dunlop, Dr. Bronte, and then EMDR as a therapy, among other things, Dr. Kim, and everybody associated at UCSF, for not only great surgical experience, but all the respect and everything shown me throughout. I was never treated in any other way than the very best. Always use proper pronouns, nouns, names that I asked for. Perfect. Thank you. And I want to thank my maker for giving me this unique life. How many people, get to live it all the way around. Yeah. I want to thank my other brothers and sisters who've gone through this ahead of me, those that paved the way, those who died in the cause, those who continue. Let's not let them have died in vain. Let's stop this bullshit. There's no room in the world for hatred. Really. If we want a better future, we have to live it. Start doing it. Stand up. Be louder than hate. Love bigger.